Good afternoon, colleagues. My name is Ray D'Souza. I'm the National Advisor for Workforce Wellbeing with the Health and Social Care Directorates. I'd like to welcome you to this webinar on sleep and seasonal affective disorder, SAD, commonly known as SAD. It's one of the issues that sleep certainly is one of the issues that has been highlighted to us consistently, along with anxiety and low mood as being the prevailing mood of the workforce at the moment. And so what we thought we would do is to have this webinar to help you to understand, get a better understanding of sleep and SAD on this occasion, and to offer you some solutions and see how you could then sort of improve your sleep and what you could do about it, not on your own. I'm very pleased to welcome, some of you may already be familiar with Dr. Dimitri Gavriloff, who has presented on a number of previous occasions for us on the issues of both sleep and anxiety. Dimitri is one of the sleep well-renowned sleep experts and currently working in Oxford in the sleep medicine department there. And of course, Professor Colin Espie. Colin is the founder of Big Health and the Sleepio app. And again, sometimes it seems a bit crass to call people world-renowned experts, but Colin is certainly that. And of that, I'm sure. And I'm really pleased that Colin and Dimitri have been working with us over the last year for the benefit of our colleagues on the front line. I would encourage you, this session, if you like, is brought as part of the Focus on Wellbeing programme that's linked to the National Wellbeing Hub. If you've attended these sessions before, the format is generally that we'll have the presentations from both Colin and Dimitri, or a conversation between them in which they'll address various issues, and thereafter we will have a question and answer session. Do feel free, and I would actually encourage you to put your questions into the chat box, and my colleague Dan will moderate these questions and put them to both Dimitri and Colin at the end of the presentation. This is designed for you to ask and for Colin and Dimitri to answer as far as they can. It's not intended to use up, we don't intend to use up the whole hour presenting to you. It is certainly about us following your train of thought, if you like, or the issues that concern you currently. So please take this opportunity to join in. So with that, I will then hand over to Dimitri. Thanks a lot for both Dimitri, to you, and to Colin for giving up your time and being with us this afternoon. Thank you.
Thanks, Ray. It takes a while to unmute yourself on Teams, it seems, when there's a big crowd. But it's great to be here. Thanks so much for having us. Yeah, pleasure to contribute, and welcome colleagues from all over who are here to join us. I'm just going to open up the slides. I've got some introductory slides to talk through just to begin with, and I know it's relatively late in the day, so we won't bore you too much with the didactic stuff, but hopefully we can kind of introduce things a bit, and then we can set up some time to talk more through the subject matter, directly pertaining to sleep. Actually, that's the kind of stuff that Colin and I specialise in, and that might be the stuff that generates the most questions. But we'll start by looking at seasonal affective disorders. So just going to make sure that that's okay, that can be seen, which looks like it can, and we'll jump straight in. So seasonal affective disorder, SAD, is really a name that is one of many names. Maybe people know it as things like winter blues, or sort of seasonal change in mood. But in terms of the diagnostic schedules, it's known by the term depressive disorder with seasonal pattern in the DSM-5. It's the most recent nosology. or schedule. And really what it describes is episodes of low mood that seem to coincide with specific seasonal change or conditions. Now, generally, for most people, that's when things get dimmer, darker, the nights draw in, as we say, and the days get shorter. But it can also, in rarer cases, be something that people notice as they transition into the longer days of spring and summer. There's a bit of a difference in terms of how people experience things at those two levels. So those who experience sort of difficulty during the summer tend to have difficulty maintaining sleep because it might be lighter, and there are other sort of small differences in terms of how people experience seasonal affective disorder, but it's something that likely affects about three in every 100 UK adults. And the kinds of symptoms we tend to see in terms of a more typical pattern of seasonal affective disorder, if you like, are persistent low mood, a sort of a loss of pleasure in doing things, maybe a bit of irritability, some feelings of worthlessness maybe, and certainly lethargy, lacking in energy. And interestingly, for Colin and I specifically, this increase maybe in sleepiness during the day, perhaps even sleeping for longer than you would do otherwise, and maybe finding it harder to get up in the morning. There's also some evidence that people might change in terms of their appetites too, so maybe a bit more craving for carbohydrates, and that might result in some changes in weight too. I've popped some places you can go to find out more about seasonal affective disorder there on the slide. So the NHS, the Royal College of Psychiatry, National Institute of Mental Health all have great information that kind of pans it out a bit. But in terms of what causes seasonal affective disorder, we don't really have any clear idea of exactly what causes it, but it's likely to be something that is multifactorial. And the evidence suggests that it's probably linked again to the seasonal changes in light levels that we see during those big transitions from summer to autumn and winter, of course, and vice versa in the rarer cases. It's certainly more common in places where winter is darker, like the UK, and it may be linked to changes in the neurochemicals serotonin and melatonin. So serotonin associated with mood, and melatonin, a hormone secreted by the pineal gland that's strongly involved in sleep, but also has important effects on things like temperature regulation and changes to kind of heart rate and things like that. And treatment tends to involve, in terms of the evidence base, self-help approaches. So this might be things that encourage more activity during the day, learning to adapt to seasonal change. Light therapy, which I put in bold there, tends to be one that's seen regularly across, the scope of treatment. So whether people experience it kind of in a mild sense or in a more severe sense, light therapy tends to be included. And light therapy tends to be delivered by something like this. I'm not sure if you can see on the camera. That's a light box. I happen to, here's one I made earlier, but we'll talk a bit more about why light's important. Of course, the evidence base also includes CBT, where there's mood disturbance. CBT is certainly indicated, and it might for some people involve medication too. The key thing here is that if you do experience difficulties with changes in mood, as and the symptoms we discussed earlier, in association with this change in season, or certainly in light levels, then it might be good to go to your GP and to talk about it with them to see if you can get the right kind of help. But why is it that light's important? Well, the role of light is crucial, particularly here, because light is the primary signal, what we call in the jargon a Zeitgeber, which is the German word for a time giver. Kind of like the timing, one of the timing signals for entraining what we call circadian rhythms. So circadian rhythms is something we're going to talk a bit more about as we go through the rest of the slides. But circadian rhythms really are the oscillations, if you like, in processes that are intrinsic to the organism that happen in response to the 24-hour changes that we get in in the environment around us. So the primary one is light. So we notice that we've evolved on a planet that has roughly equal, certainly at the equator, day and night, so darkness and light. And so that signal is very important. And you can see in the diagram there that, you know, light comes in, hits the eye, hits the back of the eye, and that is detected by a specialized group of cells known as photosensitive retinal ganglion cells. These cells then take that information and pass it to the master clock that exists within the brain, just underneath the optic chiasm there, called the SCN, the suprachiasmatic nuclei. And then that information is then kind of relayed, if you like, to all the other clocks that exist, all the other natural oscillations that exist within all the other cells in your body. So other time givers, other zeitgebers include things like meal times, activity, temperature change. All these things have an important role, but light is the main one. So keeping zeitgebers regular and consistent helps to keep sleep regular and consistent. So you've got here a kind of an overview, if you like, a schematic of what kinds of things change during the circadian rhythm. What, you know, lots of things in our bodies are affected by or have a circadian rhythm, and so it might include things like changes in body temperature, changes in blood pressure, neutrophil levels, melatonin secretion, which happens in the absence of light. So that's been implicated with seasonal affective disorder as being something that perhaps happens for longer, secreted for longer during periods of kind of lower light levels during the winter, something that wouldn't happen during the summer. And you notice that actually these circadian rhythms they're presented here in a generic sense, but they're individual too. So they pertain to our own specific clocks, and our clocks won't all be the same. So we have a sort of similar mechanism, but the idea is that we have individual differences there too. So that's kind of just a little overview. But it takes us on to kind of thinking about how sleep is regulated. And this is one of the things that I think is really helpful to talk through with people when they talk about having sleep problems. And that's through what we call the two-process model, or I'll explain it through what we call the two-process model. So the first process we're going to talk about is something called sleepiness, or what we call the homeostatic sleep drive. The homeostatic sleep drive is really the price we pay for being awake. So the more time we spend awake, the more sleepy we become. And if we think about that in terms of a kind of a day-to-day effect, we begin to get really, really sleepy later in the night, when that sleep pressures have time to build throughout the entire day. If we have a nap, as do our Mediterranean cousins in the Mediterranean, we have a sort of a siesta. We take a chunk out of that sleep pressure, we maybe go to sleep a bit later as a result. But if we allow ourselves to stay awake throughout the day, we reach a peak sleepiness at a particular point. We go to sleep, and across the sleep period, that sleepiness dissipates. It's dealt with by the various mechanisms involved in sleep. What we then have on top of this is our circadian process. So this bit is where light comes in again, and it's a very important point, specifically when we're talking about seasonal affective disorder, because light, as I say, is the thing that helps keep us to time. So our circadian day, our natural circadian day, for most of us is probably just over 24 hours, a little bit longer than a 24-hour day, maybe 24.2 hours average, something like that. And so every day we have the risk of getting later and later and later if we carry on. But light and regular light exposure helps keep us entrained, is the word we use, to the 24-hour day-night cycle. And so that light in the morning starts a process by which we start to become more alert throughout the day until we reach a peak in alertness, probably in around the middle of the biological day. And then after that, that's where we perform our best. After that, we start to decrease in alertness throughout the afternoon and evening. And when we get to the point at which the distance, if you like, between peak sleepiness and low enough circadian mediated alertness happens, we can go to sleep. We have a sleep window or a sleep gate through which we can go, and that's the point at which it's best for us to fall asleep. Now that will vary again according to where our clocks are. We have, let's say, a teenager, standard teenager, who maybe has a clock that's a little bit later. We have maybe a very, very young child whose clock's a little bit earlier. I know my my 16-month-old definitely has a little earlier clock than I'd like. You know, older people again may have earlier clocks relative to the kind of the middle ground. So worth kind of thinking about where your clock is, you know, and you know, what that means in terms of your own circadian rhythms. But if we think about why it's important, well, sleep is something that is associated pretty much with everything. This is such a nice slide. It's from an essay by a colleague in sleep in the States, Matthew Walker, and we can see here how sleep is just associated with pretty much everything. It's associated with all these physiological processes and these important elements of our function too, in terms of kind of day-to-day function. So when we think about how much sleep we need, we've talked a bit about how in seasonal affective disorder people might feel like they need a little bit more sleep, potentially again associated with that, with a change to kind of the way melatonin is secreted. But maybe this is also something, it's maybe akin to what we all feel. Maybe I know I feel it during the darker winter months. I feel a bit more hibernatey. I feel a bit more prone to kind of snuggling up and not necessarily you know, being out and about as much as on a lovely bright day, possibly associated with the kind of weather I'm getting down here in Oxford at the moment. But what that might mean is that we spend more time in bed. So what's important to know is, how much sleep do I need as a person? Is it just that I can get as much sleep as I want, or do I have to optimize my sleep within a particular range? And we can see here that actually sleep changes quite a bit across the developmental trajectory, quite a lot, particularly in the first 18 years of life. But as we reach adulthood, most of us need between 7 and 9 hours sleep. And actually keeping to what you need, you know, however much you need, is quite a useful way of thinking about, you know, keeping in sleep shape, if you like, rather than getting too much or too little. So too little sleep can have a fairly obvious effect, but too much sleep also can have the effect of can have negative effects too in terms of function. So trying to work out where you fit. And Colin, I'm sure won't mind me saying that, you know, he often talks about it in terms of your shoe size. You know, you go and you wouldn't look online to work out what your shoe size is. You'd think, well, do you know what, my shoe size is what I've measured it to be. I try on the shoe, see how it fits. I go to the shoe shop and I measure my foot. In the same way, we can think about our sleep size. And trying to get it right. So where does it fit for you? How much do you think you need? And maybe there is a bit of seasonal change, and that's okay too. But really, we're looking at how optimally we function during the day as a measure of how you know, how well we're sleeping at night. So thinking about sleep environment, what we can try and do, and this is kind of sleep hygiene advice that I've talked about before, so our regular listeners at home will be familiar with this, of course, but we want to try and emulate what it's like outside, try and mimic the natural environment. So we have the ability through things like this, bright lights like this, we can extend the day indefinitely. But actually what we might want to do is try and think a little bit more like what we'd expect to have outside. So keeping it dark, keeping it cool, and keeping it quiet are really important things for sleep, needless to say. And keeping it cool is one thing that might be particularly important during the winter months when we crank up the heating a bit. We want to keep the bedroom, you know, 18 degrees I think is a reasonable number to hover around. But if you keep it cool, also think about, you know, getting the right kind of bedding. People spend lots and lots of money on expensive tellies and all kinds of things, but might not spend that much money on good bedding, good quality bedding. So invest in the stuff that's important. Keeping the room tidy is also really important too, in terms of reducing things that might cause you to feel a little bit stressed or a little bit irritated, which might interfere with sleep. But in terms of what we're talking about today, so sleep and SAD, this is a slide I used in the last seminar I did, but I think it's a really important one. Remember the importance of keeping to kind of regular timings for the body. We want to make sure that we're getting up at roughly the same time each day. We can allow when we fall asleep to be a little bit more variable. You fall asleep, you typically go to sleep when you feel sleepy. You don't have to have the clock tell you when you go to sleep, but waking at roughly the same time each day. And crucially, if you're able to, finding one of these things there, sun, maybe not so much able to find it in the UK during weather like we've got at the moment. But if you can get bright sunshine in the morning, that's great. That's the kind of thing, that's that thing that will help the signal. If not, stick the lights on at home, or use one of these, use a light box like that, if you'd like to. And Colin and I can talk a bit more about how they're used in the Q&A. But the idea is to help entrain that rhythmicity with good signals. If you have good rhythm, this is kind of a case in point, this chap, if we have this person getting up at 6 o'clock in the morning every day, rather than at all sorts of different times, would likely have a more consistent sleep onset. Now, it might sort of change some of the red boxes during the night too, and of course we can talk more about how to manage those using evidence-based techniques too. But the main thing here is we want to have this person get up at the same time every day, so that they get a much more consistent exposure to bright light that will probably have a good impact on their sleep. Remember also, we've got to keep the bed for sleep. So when we think about getting into bed, it should be associated with feeling sleepy and being ready for sleep. You ask a good sleeper, how do you get to sleep? They sort of say, I don't really know, I just put my head in the pillow and I go to sleep. But if you ask a poor sleeper, very often people talk about, I don't know, I try this and I try that and I have to think about this and I often have to do that. Sleep shouldn't really be contingent on that kind of thing. And very often when we can't sleep, we might get involved in stuff. Or when we're finding it difficult, our phones might be there that are kind of notifying us of people getting in touch, or we might have work stuff that's on the periphery of our kind of visual field that might be triggering us a bit. Keep the bed just for sleep, get all the other extraneous stuff out, and allow yourself to associate getting into bed with that nice sleepy feeling that we all get in the evening, and getting into bed and falling asleep. The way I often talk about it with people is I talk about playing tennis. So if you're someone if you're given a tennis racket and you're told to go to the courts, then the assumption is you're going to go and play tennis. The association between the tennis racket, which is a strong stimulus, and the context of the tennis courts, put two and two together, it's pretty plain that you're going to go and play tennis. If instead you go to the tennis courts and for the rest of the week, instead of playing tennis, all you do is talk about sleep medicine, or you discuss the weather, or you play hockey, you don't play tennis, over the course of a week or so, you can disrupt that strong association between tennis racket and tennis court, such that in a couple of weeks' time, if someone says, where are you off to? You'd say, well, I was going to the courts. I'm not sure if I'm going to play tennis anymore because I do other things in the courts. So actually, what we want to do is to strengthen, with the tennis metaphor, we want to strengthen being on the courts with playing tennis. So when you go to the tennis courts, if you're not playing tennis, you get off the courts. You don't spend time on the courts if you're not playing tennis, and you don't plan to do other things on the courts instead of playing tennis. And over a couple of weeks' time, again, the strong discriminant stimulus of the tennis racket and the context of the courts, again, become associated with playing tennis. And the same is true for the bed. We want to use the bed just for sleep, just for that nice sleepy feeling. And when we're not sleeping, when we're awake, when we're alert, when we're irritated, when we're frustrated, when we're worried, we get out of bed, maybe go and do something else and wait for sleepiness to come back before coming back. And Colin and I can talk a bit more about that as we go. Napping, we might be prone to doing a bit more napping, particularly as Christmas is coming up, with structures and schedules changing, maybe not having as structured a work period as we usually have. But remember, napping steals sleep pressure that we need at the end of the day to help us get to sleep. Thinking carefully about exercise too is important. So especially on days like today when it's been really miserable outside, I've only gone for a short walk. Going for a walk in the morning, trying to get the bright light that you need, but also trying to get that physical exertion out in the morning when we're optimized to do it is probably quite a helpful thing to do, rather than doing it in the evening, which people might find is something that activates and helps. It sort of makes it more difficult to get to sleep. But these are things you can experiment with. In terms of winding down and putting the day to rest, this is something that you might want to do through meditation, through relaxation, having a nice warm bath. There are lots of things you can do to just take your mind and put it in a kind of a more relaxed state before trying for sleep. But one of the techniques that we often recommend is what Colin calls putting the day to rest, or tying up loose ends, where you might take a ledger and sort of write down the things you've got to do the next day, things that might be pressing. So I've got to call so-and-so, I've got to call them on that number, and you go through sequentially making a list of all these things you've got to do. You might do this at about 7 o'clock at night, well in advance of the sleep period, and you put your ledger on your desk ready for the next day. So once you've done that, you can be pedantic, put down as much as you like, and then go through it again. Yep, that's the email address I've got to use. That's the person I've got to call. Anything else? Nope. Okay, put it down. Maybe set a timer on your phone for the next day, 8 o'clock, right? 8 o'clock in the morning tomorrow, I'm going to come back and I'm going to deal with this list. I'm not going to deal with it until then. So you put the timer on your phone, you've got the ledger on your desk, and you can relax during the interim. You can say, when the thought comes up and says, have you done that? You can say, well, it's okay, I've done that. Anything that you haven't put on the list, you can scribble down on a piece of paper and add to the list the next day. But these are kinds of techniques that you can do that are kind of simple things. If you're really struggling with your sleep, why not use Sleepio? It's now available to everyone in Scotland through the NHS, and Sleepio is CBT for insomnia. So this is the first line recommended treatment for insomnia, now made available through the NHS and through the internet with your own virtual therapist, the prof. So getting started, you can go to the website there. I'll make sure that seems to have been cut off, but I'll make sure you can access the website at the end of the webinar. You go through a sleep test, and then you get a sleep score, and following that, you then get involved with the content directly through a series of cognitive behavioral sessions. There are 6 weekly sessions, about 20 minutes each, and you go through them at your own pace and begin to put in these evidence-based treatments into practice to improve sleep. So here's a kind of a quick recap on what we talked about. So most important thing, keep sleep regular, regular rise time, regular routine, plenty of bright light in the morning when you wake, particularly when you wake naturally, not too much if you're having to wake yourself early. Keep the bed and bedroom dedicated to sleep, get all that extraneous stuff out, develop a wind down routine to help keep sleep sort of associated with that relaxation, that quiescence, protect sleep from competing demands. So if you've got stuff that's getting in the way of sleep, move it to elsewhere in your day. Get that phone out of the room if it's pinging away. Keep active, particularly during the morning and the earlier part of the day to promote good sleep. Keep sleep for the nighttime. Napping during the day, remember, is going to steal sleep pressure from when we need it later in the day. And keep sleep the same on weekends and weekdays. I think this is a really helpful thing. The whole notion of a lie-in is something that the body doesn't really expect. It's something that we're kind of foisting upon it. And if you're still struggling with your sleep, do try Sleepio, which is now available, as I say, for everyone in Scotland. I'm going to leave it there in terms of the slides, and Colin and I are now at your disposal to talk through any questions you might have.
Yeah, thanks, Dimitri. Can I just add my thanks to Ray and the team for inviting us to participate today, and very keen to hear your questions and to answer them as best we possibly can. So thanks, Dimitri.
Pleasure.
Thanks, Dimitri. It's Dan here. So I'm going to start posing some questions to you both. We've had some great ones through, and yeah, what a great presentation, Dimitri. So insightful, very informative. Lots of great info in there. Some lovely words, Zeitgebers, I picked up, and just so relevant at the moment with the weather, particularly today. It's cold, it's dark, it's windy, it's wet, and I know people will be really feeling the effects of that. So the first question is hopefully a nice easy one about sleep. We'll go to Colin first, I think. So it's
give me the easy questions, Dan.
Yeah, absolutely.
Give the difficult ones to Dimitri.
Yeah, we'll do that. We'll make sure we do that. So first question is, why are some people morning people and some people night people?
Well, you know, I think the simplest explanation for that is that nature has thankfully designed things that we're not all the same. Yeah, you know, we're not all the same in any other respect. Why are some people taller or shorter? Why are some people with blue eyes or brown eyes? And you know, why are some people morning people? You know, they've what we call a shorter circadian period. Dimitri referred to the circadian period being approximately 24 hours. It's slightly longer than 24 hours, in fact. But someone who's a morning person has got a shorter circadian period than someone who's a night owl, and there's a fraction of hours difference in that. And it's just part of an individual difference. Now, why might that be the case? Well, we can surmise, I think, a little bit about that individual differences in general in life are helpful things. You know, taller people can reach the top shelf, or whatever. There's advantages to having diversity in populations, in the skill set, the natural attributes, people's biology, and so on. And you can surmise that perhaps historically, if you had people who were able to be awake at night or more likely to be alert at night, that was a helpful thing, perhaps for safety reasons. And likewise, if you had people who were able to be up early in the morning, that's also a good thing. And so you can organize your society in such a way that that diversity plays well into the resources available to you. And I think we should bear in mind too that exactly when it was, Dimitri, but electric light is an incredibly recent invention. In terms of the history of time, it was probably invented about 2 seconds ago. It's a very, very recent invention in the last 100 years or so. And I remember, and I know I don't look old, but I do remember the Leary coming round. Does anyone know what a Leary is? And some people on here, well, the guy who came and lit the gas lamps in some of the streets, because people didn't have electric light, even in some places in the 40s and the 50s and the 60s. Giving my age away now. So the ability to be awake 24/7 and to do away, if you like, with individual differences and make everyone the same is perhaps not a very good thing, but also potentially a recent pattern of behaviour.
Thanks, Colin. Brilliant. Lovely way of putting it and explaining it. And of course, you don't look old. You don't look a day over 20.
So that means Dan, that you did know what a Leary was then.
Absolutely, I was there. I was around in those days. Good stuff. So on the topic of lights, we've had quite a few questions about the light boxes that you showed, Dimitri, actually. So I'm going to come to you for this one, as you had one to hand. So the first question is quite simple, in that do they work? Have they been shown to work?
Yeah, so the evidence base with light therapy is not a particularly robust evidence base across all domains. So it's something that is we think about why people might use light within the seasonal affective disorder area. Again, the evidence base, I think, is there's certainly some there. I'm not entirely sure of the robustness of that evidence base. It's not an area in which I work, but people these lights are often marketed as what we call SAD lamps or SAD lamps. The way we use them in sleep medicine tends to be we use them as a proxy for sunlight. The best light box in the world is that massive ball of fire that exists in the sky. It just happens to be the case that in the UK we haven't got access to it in quite the same way as what we'd like. So we use light boxes as a proxy. We know from the literature, from the science, of the effects of light, and so these light boxes, regardless of what people are struggling with and how they're being used, they really are only a proxy for sunlight. There's a couple of things about the particular types of light boxes that's important. The light boxes that are used tend to be standardized to something called, they have an intensity, they call it a lux intensity of 10,000 lux. So 10,000 lux is sort of the benchmark, I guess, against which many of these light boxes are produced. And the idea is that there's 10,000 lux at a particular distance from the eye. So if it's a larger light box, it might be the case that you can put the light box a bit further away from your eye. If it's a smaller light box, you'd need it closer to the eye to get the same kind of intensity of light. It's worth just remembering that on a bright, sunny summer's day, you're looking at like 150,000 lux from the sun, something like that. I don't know, Colin, you can correct me if I'm wrong. But a light box in the house even close by you may seem far more intense in terms of its light. That's just because of the situation in which you are. The light outside in a bright summer's day is much more diffuse. The light inside, even if it is from a light box, is fairly focal, and so you kind of get the intensity in a different way. To kind of come back to the evidence, we know from the circadian science that there's a point at which your body temperature is at its lowest point. Call it the circadian nadir. Happens about maybe depending on the individual, maybe 2 or 3 hours before you wake naturally. Now that point is a point at which we can kind of use it as a circadian marker for a kind of a part of your clock, if you like. It could be one of the numbers on the dial and the body clock dial. If you give yourself bright light before that, we know that actually it can be unhelpful in terms of pushing your sleep later. This is very often what we see in younger people who are being forced to get up very early for school, for example. It may be that it's exacerbating their delay in when they go to sleep. And then the opposite, if you get the bright light after that point, you know, when most of us would get it, we wake up naturally and we get the bright light from the sun. That has the effect of keeping your sleep tight. As you know, come back to Colin's point, it pulls the circadian period in a little bit so that we wake at roughly the same time the next day. So that consistency is something that happens if you're allowed to sleep in naturally. When you're not allowed to sleep in naturally and you have to wake up earlier, then then there's a bit more to it. And actually, I'm having to simplify some quite complex science to make it to make it conversational. But yeah, Colin, jump in.
Yeah, maybe just, you made a really important contrast between how bright a light box is and outside light. Even in a winter's day, there's probably still 80 to 100,000 lux. You know, so it's 8 to 10 times brighter than a light box. But if you put it on in the house, it feels incredibly light. So there's an interesting contrast there. But I think the other contrast that you should pay attention to is the fact that actually lighting in the house doesn't actually give an awful lot of light. You know, that your lamps around the house, we often quite like subtle lighting in the house. And we think, okay, well, the lights are on. But the lights are on at home, they're not necessarily all that strong to keep you awake.
Yeah.
So therefore, in the winter time compared with the summertime, because in the summertime we do actually, we not have a lot of sun, but we do have a lot of light, and we have relatively long days, particularly in Scotland. So the ability of the circadian system to time your sleep is much stronger in the summer, and indeed that bright light can prevent you getting to sleep, and that's a good illustration of you know, the effects of light. You want your house dark because you can't get to sleep. It's so bright at night and it's bright in the morning, so you keep the room dark. So it's kind of the opposite, that you're trying to expose yourself to light in the winter time in order to be able to curtail this kind of tendency for everything is to de-arouse and for your mood to flatten and for your sleep to you know, kind of disperse, if you like, into the corners. You want to keep everything relatively tight. I think one other thing I would say, Dimitri, is that, you know, you'll have heard of melatonin even before Dimitri was explaining it today, and give a very good explanation of it. But the key thing to bear in mind here is melatonin isn't something you buy in Boots or something you buy in a drugstore and take in tablet form. Melatonin is a naturally occurring hormone, as Dimitri explained, which is secreted in the brain. And the way that bright light works is to influence the melatonin curve. And light and darkness is a much better way of trying to establish your sleep-wake timing than taking melatonin pills. There's much less evidence for that than there is for using bright light judiciously. And again, experiment to see if you can get it right. I think that's really important to say as well.
Thank you, Colin. That's really relevant because we did have some questions about supplements and, as you mentioned, hormones such as melatonin there as well. So I think that's really, really relevant, and we've touched on some of those questions. We got loads of questions, so we're certainly not going to be able to get around to all of them, but we'll answer as many as possible. So there's a question here around SAD and sleep. And is there such a thing where too much sleep may have a negative impact or kind of exacerbate SAD? I don't know who wants to take that one.
I'll take a quick start for that when I pass on to Dimitri. There's lots of things about our biology which, at the extremes, cause difficulties. We often call that hyper something or hypo something. So if you're, if you've got too much of something or too little of something, you can have problems at both ends. And if you think about depression as a disorder, it's associated often with insufficient sleep and with insomnia, but it's also associated at times with hypersomnolence and too much sleep. And what this tells us is that most things are distributed in a normal distribution curve, and the range of normal can be quite broad. I mean, Dimitri was talking about 7 to 9 hours of sleep as an average, but you probably also saw in that graph there was also a tail to that, like 6 to 10. So really it's quite a broad range to figure out how much sleep do I need. But people are getting insufficient sleep, less than that, or more sleep than that, other people are going to have greater difficulties. And that will tend to be associated with mood problems during the day, because the primary function of sleep is to restore and enable daytime function. And if your sleep is degraded or is excessive, you'll get the effects of that in your day-to-day life, because sleep is, if you like, nature's medicine, and getting too little of the medicine or too much of it causes problems, if that makes sense. I do, if you want to pick that up, Dimitri.
Yeah, no, I completely agree. And one of the things I guess is interesting to think about is if you're sleeping more, what are you doing less of, right? So part of what the way we think about things like sleep problems is we talk about perpetuating factors. What are things that are keeping the problem stuck? And if you notice that people have low mood, very often there's a low motivation to do stuff. It's understandable. You feel less inclined to go out and see people. You feel maybe less inclined to get out and do some exercise. All of these things we know intuitively, but we also know from the experimental evidence that these are helpful things for mood. It's important to get out and to do more when you feel less inclined to do so. So if you notice that you're sleeping more, ask yourself, maybe what am I missing out on?
That's a great point, Dimitri. I mean, if you think about the other things that are essential for life, I mean, I think there are only 4 things really that are essential for life. You need oxygen to breathe, and you need water to hydrate, and you need food for nutrition. You need sleep for all the daytime functions. But if you think about if you have a poor oxygen supply and poor quality air, you will become unwell. If you don't have enough water, if you don't have enough food, but likewise, if you overeat, your diet isn't healthy, then that causes health problems. Drinking too much water, believe it or not, can also cause some difficulties. And we're all aware of the problems associated with hyperventilation. If people start breathing, get anxious and breathe too much, and it makes it difficult to function. So these 2 ends are important. This is why I think what Dimitri was suggesting to everyone was really important about don't just pick a value and think that's exactly what it should be, and be try to get the same value as everyone else. Try to figure out and be willing to have a bit of trial and error to find out what your best sleep pattern is for you and the best time for that. And maybe in winter, it is a little bit different than it would be in the summer.
Thank you both. Really, really interesting stuff. I'm going to move maybe slightly away from sleep and talk a little bit more just about SAD. So Dimitri, you signposted some really interesting articles and useful kind of sources of information. I know that NHS Inform has a lot of good information on seasonal affective disorder too. But we've had just a question around, would I need to be diagnosed by a GP for seasonal affective disorder? And kind of in that case, what treatments might work? I know you sort of slightly alluded to some of those, but could you just expand on that, Dimitri?
Absolutely. So if we think about diagnoses as being important in terms of accessing treatment, then I think that's the kind of best way to think about it. If you already have, so if we think about, again, seasonal affective disorder as being a spectrum, or being on a spectrum again of severity, where you may have people who experience a little bit of change. I experience certainly a little bit of change in terms of how I feel in relation to the nights drawing in. That was not necessarily seasonal affective disorder in terms of, it doesn't necessarily meet the diagnostic criteria for it, but it's a little bit of a change, and maybe I adapt as an individual to that in a particular way by, as Colin said, maybe I sleep a little bit more. Chance would be a fine thing with 2 small kids, but you know what I mean. That kind of thing happens as a result of my own initiative. I'm thinking about it a bit. If I'm really struggling, if my mood is low, my sleep is changing in a way that I don't feel like I have any control over, if things aren't happening in a way that's helpful for me, seeking advice is a very sensible thing to do, and to do, the best person to go and do that with initially is your GP. That's why GPs are there. They're the front door through which we access these services. So diagnosis or not is not the key here. The key thing is to go and talk to someone who's appropriate and who can help. And if they identify that there is a mood problem, then they will be the right person to advise on the appropriate treatments.
Yeah, and you used an important word there, I think, Dimitri, that you used the word adapt. I think is quite an important concept about how do we adapt or adjust to limitations and strengths, and how we're able to function at different times or in different ways. I think diagnosis and treatment is one way of looking at it. Like, I've got a disorder and needs treatment, and certainly we've asked people to say you shouldn't get treatment for something that is really causing significant distress. But I think most people make some adaptation to dark nights, and that we should also be thinking about, well, what can we do ourselves to try and ameliorate this, to mitigate this, to manage this, and to some degree to accept it, as well as thinking about, how do we eliminate this, or how do we treat this. And I don't think they're necessarily alternatives. I think you can do both at times. It's the kind of thing that people often take to their doctor, and the doctor doesn't necessarily have the right things to say or know a lot to say about this. And we'll discuss, well, do you want to go on an antidepressant? Most antidepressants people are on for years. But equally there is some medical management short-term that can be effective using antidepressants for seasonal affective disorder. Some people get very, very, very low. They get very depressed. So it's important to pay attention to how you're feeling and the extent your symptoms are dominating your life and affecting your ability to function. And you'll know yourself well enough, or people close to you, when it's just got to the point that they really do need help. And talking things through is, as Dimitri is saying, is, the best policy with someone you trust and who's got expertise in the area.
Thank you both. That's a really insightful explanation and response to some of those questions. I'm gonna get us back to sleep now, and this one's come through a few times. It's around shift working. So I think we'll start with Colin, and I think some people have raised that it's difficult to find that pattern whilst shift working and find that regular sleep pattern that really works. So do you have any tips or advice for people who are shift workers? Yeah,
this is a big issue for a lot of people. The majority of people find it a little bit easier to delay the clock than to advance the clock. In other words, it's a little bit easier for most people to stay up later than it is to fall asleep earlier and to get up early. We do, obviously night owls find it a little bit easier to do this because they're more extreme night people, so they find it naturally easy to delay the clock. But we also know from jet lag, for example, that your adjustment, if you're traveling out to the States, for example, you're traveling west, is a little bit easier to adjust to, because what you have to do if you fly to New York, you're 5 hours behind, you have to stay up a bit later, and it's easier to stay up later. But when you get back home, you're chasing the clock, and that's really quite a hard thing to do. So the difficulties that people who are morning people have with night shift work in particular is that they're not well adjusted to that. They would naturally want to fall asleep, say 8, 9 in the evening, at 10 o'clock, whatever, certainly mid-evening. And it's a harder struggle for them. But by the time you get to 4 in the morning, they're going to wait. They're going to feel more alert. But they're going to struggle to sleep in the morning when they get back from work, having a night shift. So I think the first step is to understand what we call your own chronotype. Secondly, to understand that we're not actually really designed for shift work, particularly work that shifts back and forth, because that doesn't allow our system to settle. So shift patterns that tend to run forward over time are a little bit easier to adjust to. So if you do nighttime and daytime and back shift, etc., than ones that are rotating or just random or all over the place. These are much more difficult to adjust to. People generally, when they're working night shift, have shorter periods of consolidated sleep and sleep for less than they would at night. And it's best to try and keep it consolidated. And often they have nap periods during the day to try and manage as well. So some of the rules that Dimitri was mentioning about keep your sleep for night, etc., we have to look at a little bit differently, so that people don't become sleep deprived, because that can also be dangerous if you fall asleep involuntarily. Dimitri, you could probably get some things to add about shift work, I think.
Yeah, so just absolutely to reiterate what Colin's just said about that, we want to kind of prioritize sleep and recognize that actually it's not optimal. It's not what we've evolved to do, and that doesn't necessarily mean it precludes us from doing it. So if you have a consistent pattern, as Colin was saying, you're a night shift worker, and actually you're a night owl, and that kind of works out all right. It's not that big a deal. Great. But it's when people have shifts that change, or when they're being forced to work in a pattern that doesn't really accord with their own chronotype, that people find themselves experiencing difficulty. We've actually done a webinar on this, I think, that has more information. It's just to kind of redirect people to it too. But the other thing I think that is really important about shift work is, remember, you will be doing the shift work. The world doesn't do the shift work. So your family doesn't do the shift work. Your kids don't do the shift work. Your friends, all the other stuff that doesn't happen, in the same way, will need to be seen to. And so what that might mean is you might not get the opportunities you get routinely to spend time with your loved ones, or to go out for a drink with your friends because you're working. So making time for that kind of stuff is important. Making time for your sleep is clearly critical, but it's also something that might need to be woven into a more complex family situation too. So, for example, a couple of things that spring to mind, they may seem a little bit simplistic, but carving out time, making sure there's a sign on the door saying don't come in, this is my sleep time. Putting earplugs in, using white noise to drown out daytime sounds if that's easier. Things like that things that people might not consider kind of routinely, because what you're trying to do is to pretend it's night. And it might also include things like using dark glasses at particular times to stop the impact of light, maybe in the morning as you're going home. So it's very difficult to kind of give general advice, because shift patterns are different for different people, and of course people have different chronotypes. But just to kind of refer people back to that seminar we did, or to the webinar we did, and to to also remember that if it's not working for you, then that's okay too. So this is not something that you're naturally programmed to be able to do. The fact that you can't do it or you're finding it difficult is not a weakness on your part. It's biologically sort of inevitable for most of us. So I think the point here is that if you are experiencing difficulty, do talk about it. Do try and find an optimal, whatever, to whatever degree that's a possible thing to do, solution. It might be talking to your line manager, it might be talking to family, it might be talking to friends, whatever. But the idea is to try and try as best as you can to kind of knit together all these jigsaw pieces. Huge mixed metaphor there, but you know what I mean. Put the jigsaw pieces together. You don't knit, you just jigsaw pieces together. But to try and make it work, because it is very complex. So just some generic.
Also, apart from the individual responses which we're talking about here, and think about the family context. I mean, I think we have had, and we're very open to have more conversations around public health measures in relation to sleep. I mean, as a society, do employers, including public services in the UK, including health services for that matter, is there enough rational planning around sleep and its needs and individual differences? I'd love to have some conversations around that more with people in Scotland too, about what's the best way from an occupational health perspective we can bring sleep into the equation to make sure that the majority of people remain healthy. Another example of that, which is probably not relevant to today's call particularly, but I'd love to see all higher and examinations, all important school leaving examinations taking place in the afternoons, not in the mornings. Teenagers are not going to do well in exams scheduled for the morning, and so why not schedule important exams for the afternoon? Simple things like that. Apart from thinking about how can we solve the teenager sleep problem, the other way to think, how do we address the societal challenges when so many people are affected in a similar way?
Mm-hmm.
Thank you, Colin. Lots of food for thought there for sure. And we have had some questions in about kind of employers and what they're doing to help support their colleagues and employees with some of those issues. People have mentioned that they struggle to get out for a walk with a 30-minute lunch break and things like that. So I think it's a really, really apt point, and I think it's a good one to finish on, actually, because looking at the time, I want to make sure everyone gets a little break, maybe before they're wrapping up their day or they're going to their next meeting. So I just wanted to firstly say thanks to Colin and Dimitri for the presentation. I thought it was absolutely excellent, and these will be available on the National Wellbeing Hub within the next week or so keep an eye out for that. Dimitri, you mentioned those other webinars and workshops that we've delivered in the past. They're all on the National Wellbeing Hub, so please do go and have a look there as well. I just wanted to also finally just say thanks to the Focus on Wellbeing programme for having us. It's been an absolute pleasure being able to read through all of your questions. We will write up a little Q&A following this for some of the key questions that we didn't get round to, so we'll make sure that's circulated with the webinar as usual. But keep an eye out for this recording, and the slides will all be on there. So I'll just pass over to Dimitri and Colin, say thanks and goodbye.
Thanks and goodbye. Yeah, it's been a real pleasure.
Thanks everyone, great to see you all. Hope you sleep well. Have a great Christmas when it comes.
Of course, happy Christmas everyone, or seasonal holiday. Cheerio. Bye everyone.